Hi, good afternoon, everybody. We are back on Instagram talking about burning mouth syndrome and mast cell activation. We did this last month, but unfortunately, it didn't save to Instagram. So I'm going to do it again, and hopefully, we'll be successful, or I'll be successful in saving the recording to Instagram so people have access to it later. So I want to tell you a little bit about my journey taking care of patients with burning mouth syndrome and how I got into it and what mast cell activation has to do with burning mouth syndrome and other neuropathic pain conditions. Early on in my experience as an anti-aging practitioner, working with hormones and mainly with women who are going through the perimenopause and menopause transition, I had a patient who wrote a testimonial about how successful her hormone restoration program was in helping her perimenopausal transition symptoms. And in that testimonial, she mentioned burning mouth syndrome. And she said something like, my energy in the 2 months I've been on my hormone program, my energy is much better, my moods are better, my libido is better, my muscle definition is better, and my burning mouth syndrome isn't nearly as bad. And we posted it on my rudimentary, at that time, website 15 years ago. And didn't really think much about what burning mouth syndrome was until other people started approaching me and saying, I have burning mouth syndrome. Do you treat that? And I had to say, not really, but I will look into it. And so I did a huge amount of reading in the scientific literature and thought, why would hormones help a pain condition? And of course, in the 15 years since that initial foray into the scientific literature, there's been a lot of information about what hormones have to do with chronic pain conditions and how hormones can help. So at the Sklar Center, we have a number of ways of addressing burning mouth syndrome. And in addition to the usual medical approach, which is to use either anti-seizure medications like gabapentin or antidepressant medications like Paxil or Prozac, we use hormones really as the foundation of our treatment program. And we have been successful in anywhere from 2/3 to 3/4 of our patients getting significantly better. And significantly better means it's not ruling your life anymore. And those of you who have burning mouth syndrome, that is significant, understand how it rules your life, how chronic pain depresses you, makes you anxious, cuts you off from socializing, and cuts you off from living your best life. So hormones turn out to be the foundation of what we do because it's been so successful. Some of the other approaches we have, which have added to that, are replenishing vitamins like vitamin D, vitamin B12, and folate, and other B vitamins that are so important to nerve function, replenishing those vitamins. Looking at minerals that are deficient like zinc and iron, which have been associated with worsening pain in neuropathic pain conditions. We treat viral infections, which for some people seem to be an underlying cause, things like herpes virus, herpes type 1 and 2, varicella, which is the virus that causes chicken pox and then later on in life shingles. These have been associated with burning mouth syndrome, and in some patients, treating them with antiviral medications has brought about relief of pain. One area that we explore, and it's been shown in the scientific literature, there's been a few articles written by Dr. Lawrence Afrin, who's a hematologist oncologist, on the issue of histamine and other chemicals released by mast cells. And so mast cell activation and overactivity of mast cells seems to be a significant factor in burning mouth syndrome for a number of people. So let's talk about what mast cells are and how we approach treating somebody who we think might have mast cell activation and how we would go about treating it. Mast cells are in many places in our bodies. They are in the interfaces of our bodies with the outside environment. So what does that mean? They line our mouth and our digestive tract because substances come from outside when we eat, and our bodies have a very complex and sophisticated way of determining if what we're taking in the form of food or whatever comes in our mouth, is safe for us. Mast cells are part of that. Mast cells line our respiratory passages. They line the linings around our eyes. So people who have environmental allergies, pollen, dander, activates mast cells, and what do you know? Your nose is running, your eyes are tearing, you may have asthma and activation of your respiratory tract with contraction of the bronchioles, which is what asthma is. And because the mast cells are in so many areas of our bodies, the symptoms of overactivity are hugely varied. Mast cells are even in our brain. Mast cells are in the fear center of our brain. So the kinds of symptoms that come from overactivity of mast cells are really varied. And it turns out that mast cells contain 1,000 chemicals. So they release histamine, what are called cytokines that you've heard of ever since the COVID pandemic, which are inflammatory chemicals. And they have been associated with allergic responses. They guide tissue development and growth, so they're not necessarily always a bad thing. And they regulate a number of different processes in our bodies. It turns out mast cells weren't, and the importance of them really wasn't recognized until pretty recently in the history of medicine, which goes back thousands of years. It's really been in the last 15 years that we've begun to understand so many conditions that were puzzling that now we know are due to overactivity of mast cells. So there's a lot of things we can do to treat an overactive mast cell. And even more than that, we want to try to figure out why these cells are overactive. And in many cases, we are able to figure that out. So things that are signs of mast cell overactivity are everything from gastrointestinal disorders like abdominal pain and bloating because of the overactivity of mast cells in the colon and stomach, headaches, poor concentration and poor memory, other GI symptoms like diarrhea, nasal or eye symptoms like the ones I mentioned, swelling, redness, and tearing, interstitial cystitis, which is an overactivity of the bladder where you have to keep urinating with great frequency, small fiber neuropathy, which is a nerve condition of certain fibers, the small fibers, which we think play a role in burning mouth syndrome for some people. Being intolerant to pharmaceutical medications can be a sign of overactivity of mast cells. Brain inflammation with brain fog can also come from overactivity of mast cells in the brain. And we know that stress destabilizes mast cells in the brain. And so with the release of the chemicals from mast cells like histamine, which is a pain-producing chemical, we see associated pain conditions like trigeminal neuralgia. And in its furthest and most serious manifestation of mast cell activation is anaphylactic reactions, which is a very severe allergic reaction where your bronchioles in the lungs constrict and becomes difficult to breathe, blood pressure plummets, and it is a life-threatening condition. That is due to mast cells, and it can happen as a result, peanut allergies that are life-threatening, that's an anaphylactic reaction. Mast cells are involved in that. So why might somebody have overactivity of their mast cells? We're learning more and more about this. For one thing, we're learning more about the importance of mold in our environment and water damaged buildings and the mold that grows after a building has become water damaged. This obviously is going to become more and more significant with climate change and increased flooding. So if you have water damage in your home, don't just pass it off as a nothing. Within 48 hours of water damage, mold is starting to grow in the drywall in your walls, and it needs to be attended to. Viral infections, we think, can cause mast cell activation. And we notice in a lot of our burning mouth patients, Epstein-Barr virus reactivation. So Epstein-Barr virus is in the herpes virus family of viruses. Most of us in the United States, by the time we're 2 years old, 90% of us have been exposed to Epstein-Barr virus. And usually it is dampened and contained by our immune system, if our immune system is healthy, and doesn't bother us for the most part until possibly later on in life. And it comes out as mononucleosis, which young people, teenagers, and college students tend to have. And it can show up later in life as reactivation and cause of fatigue and a number of other problems, including burning mouth syndrome. There are other viruses as well, and Lyme disease has been known to be, Lyme infection and Lyme co-infections are some of the causes of mast cell overactivity. Toxins can also trigger mast cells. So the toxins that are produced by mold, they're called mycotoxins. They're volatile organic compounds that can make us very ill. And in addition, heavy metals like mercury can cause mast cell activation. Some intestinal infections will increase histamine, like E. coli in the intestine, and some of the other issues of small bowel intestinal overgrowth and small bowel fungal overgrowth, which cause a lot of GI symptoms, but at their root may have mast cell activation. So you can treat the gut and treat the gut, but if you don't do something about the mast cells, the symptoms will continue. So how do you know if you might have mast cell activation? If you have a lot of seemingly unrelated symptoms, they may end up being unified in a diagnosis of mast cell activation. So you have GI problems, you have diarrhea, you have environmental allergies, you have a dizziness when you stand up, you have intolerance to medications. A regular dose of medications will completely throw you for a loop. And one of the kind of cardinal signs of mast cell activation is called dermatographism. That means writing on your skin. And so one of the ways you know if you have that is to take your forearm and make a scratch. And if that scratch turns pink, that is the result. If it turns pink along the line where you scratched, those are mast cells getting activated, mast cells in your skin, and releasing histamine, which creates a small inflammation and turns your skin pink. So that can be one of the ways that you know if you might have mast cell activation. So the question is, how do we diagnose it and what do we do about it? There is not one lab test that will tell you if you have mast cell activation. There are tests that will tell you if you have the more severe manifestation called systemic mastocytosis, which is a very serious health condition. And so doing a lab test called a tryptase level, it's done on blood, it's a serum tryptase. If that's high, that can be an indication of a more severe condition called systemic mastocytosis. And somebody who has that, you would definitely want to see a hematologist for treatment. Most of the people that we see do not have that condition, but they have these myriad of other symptoms due to overactivation of their mast cells, not systemic mastocytosis, a lesser sign, a lesser activation, but nevertheless with, many health problems resulting. And burning mouth syndrome is one of the things that can happen with mast cell overactivity. So there are a few different protocols that we use to try to help with mast cell activation if we think somebody has it. So if somebody has environmental allergies and they are sensitive to medication, signs like that, and they have dermatographism with their burning mouth syndrome, I really go for treatment of mast cell overactivity as one of the initial things that we do. So two types of medications that we use. One is a histamine type 1 blocker, which are the usual antihistamines for allergies that you're familiar with. Things like Zyrtec and Allegra and Clarinex and Claritin. The one that we've liked the most is a newer one called Xyzal, also known as levocetirizine. And Xyzal is available without a prescription at the pharmacy. And it is a histamine type 1 blocker. And so we have people start using Xyzal, taking a half a tablet a day and eventually getting to a tablet a day over the next week if it's not sedating. And then add to that a histamine type 2 blocker, which are the ones that help with too much stomach acid. So things like famotidine or Pepcid, which is the brand name. And we have our patients start with a capsule a day, 40 milligrams. And again, this is available without a prescription at the pharmacy. Taking one a day, and if no side effects, after a while go to 2 a day. We combine that with a low histamine diet, because not only does our body release histamine, we get histamine in some of the foods that we eat. And some foods actually have a lot of histamine in it, and some foods are histamine activators, even though they don't have a lot of histamine in them. And so we try to have people on a general low histamine diet. And the guidelines for that are avoiding canned foods, ready-made meals. As food sits, it tends to produce histamine. Actually, as much as we like fermented foods for the probiotics in fermented foods have a lot of histamine in them. So things like older cheeses, kimchi, sauerkraut, those wonderful fermented foods that are great for so many people are not great if you have a histamine problem. Don't allow foods to linger outside the refrigerator, especially meat products. They will develop histamine. And so it means eating freshly made, freshly bought foods, things to avoid, and fresh fruits, fresh vegetables. Egg yolks are good, chicken, milk and milk products, most leafy herbs. Things to avoid because they have high histamine: alcohol, pickled or fermented foods, like I said, like sauerkraut. Mature aged cheeses tend to have a lot of histamine. Smoked meat products and preserved meat products like salami, ham, and sausages. Shellfish has a lot of histamine. Beans, unfortunately, chickpeas, soybeans, peanuts have a lot of histamine. A number of nuts do, like walnuts and cashews. And salty snacks and sweets that are made with preservatives and artificial colorings tend to be histamine activators. So we have people avoid histamine containing foods and histamine releasing foods while being on antihistamines. In addition to the two that I mentioned, Xyzal and Pepcid, sometimes people need to go further in terms of using antihistamines. One of the things that we like to use a lot for burning mouth syndrome, because it is a good anti-inflammatory and releases natural endorphins in our body, which is our natural pain relievers, is called low-dose naltrexone. And naltrexone seems to be especially good for what are called central pain syndromes, where the pain isn't just happening out at your tongue or in your lips, it now lives in part of your brain. And that's what happens with chronic pain. A lot of chronic pain becomes a central or brain problem. And low-dose naltrexone turns out to be helpful for those central pain syndromes. Low-dose naltrexone has antihistamine action, and we've had a lot of good luck with patients who are on our hormone program and then add low-dose naltrexone. So if you are somebody that seems to have histamine problems, you may want to add low-dose naltrexone to the antihistamine Xyzal and the antihistamine for the gut Pepcid. There are also some other ones. Singulair is something that lots of asthmatics take because it is a mast cell stabilizer. In addition, something called ketotifen, which is a mast cell stabilizer. It blocks H1 histamine. It needs to be made in a compounding pharmacy because it's not commercially available. And the other one is cromolyn, which a lot of asthmatics are familiar with because they're on cromolyn, because it blocks mast cell release of histamine and some of the other mast cell inflammatory chemicals. So there are a lot of medications that are helpful. There are lifestyle things like a low histamine diet. There are supplements that can help with histamine. A lot of people are deficient in an enzyme called diamine oxidase. It's abbreviated DAO or DAO. It helps to break down and clear histamine. So a lot of times while someone is on a low histamine diet and using antihistamines, we recommend a DAO containing enzyme preparation, and a number of the supplement companies have enzymes preparations that contain diamine oxidase. Wonderful natural antihistamines are quercetin, perilla, vitamin C, and some of the B vitamins, which we recommend being sure that you have adequate numbers if you have burning mouth syndrome, because B vitamins are so important to proper nerve function. B12, B1, pantothenic acid, and B6. These are all important for healthy nerve function, but also for clearance of histamine. The other thing is, if part of your histamine problem and histamine release is due to stress, it's really important to do activities that are stress reducing, that will lower the amount of histamine getting released from, like, the amygdala, the fear center of the brain. So things that are helpful are massage, craniosacral treatment, taking a walk in nature, listening to binaural beats, which are recordings that have particular wavelengths that are very brain calming. And also things like lymphatic drainage and liver detoxes with preparations that have milk thistle or bitters. Bitters are a very old-fashioned way of activating and processing things well through the liver. So all of these things may help with the processing of histamine that's produced from mast cells. So that's to give you an overview of mast cell activation and especially how it has bearing on burning mouth syndrome in particular. And let's see, we have some questions, so I'm happy to look at the questions while I'm sitting here and see if I can answer some of these. Is a low histamine diet permanent, or does the body eventually react less when a normal diet's introduced? It really depends on if you've gotten to the underlying cause of why the mast cells are activated. So if you have a water damage, mold situation in your home and have activation of your mast cells and histamine release, presumably as you repair your house and have remediation done and remove the mold, you will remove the source of the activation of your mast cells. And so all of the treatment things that we do, like the medications and the supplements and the low histamine diet, presumably when you do no longer have the trigger for activation of the mast cells, you would be able to reintroduce various high histamine foods. The same thing goes for if Lyme is triggering your mast cell activation. As the Lyme and co-infections are treated, presumably you would have less mast cell activation and less need for a low histamine diet. Let's see, another one. When I was under high stress, my feet and hands burned when I went to bed, and I noticed them burning as the day progressed. I started B12 vitamins and the burning stopped. So that's a perfect example that very well could have been mast cell activation. And like I said, B vitamins, including B12, help your body process the histamine. So that may have been why the burning stopped with the use of B vitamins. Let's see if we have any other questions. And so it's toxic load, absolutely. Toxic burden plays a role in mast cell activation. So we are always looking for where are the toxins coming from? How can we remove the toxins from the environment? How can we remove the toxins from your body? So I hope this has been helpful for you in terms of understanding what's going on. And when we talk about treatment for mast cell activation, when we're taking care of our burning mouth patients, or if you are not a patient at the Sklar Center and you're seeing your own doctor, this is good information to take. And especially it's helpful because a lot of this are things you can do on your own. And so the antihistamines like Xyzal and Pepcid, the low histamine diet, these are all things you can try on your own. But if you are running into problems and need lab testing or a discernment of could you have systemic mastocytosis, which is much more serious, then you would need to see a physician and have lab testing done and get a serum tryptase test done. So hopefully we will be able to save this recording and have it on our Instagram, and it also we will post it to Facebook and YouTube for your future viewing. So thank you so much for listening today, and we will be back. Bye now.